Hi, I'm Erica Champagne, an occupational therapy assistant, and I'm here with Miss Kim to do a caregiver demonstration on passive range of motion exercises for a client with left hemiparesis due to a CVA, a stroke. The first passive range of motion exercise that we'll do are for the shoulder. Passive range of motion means that I'll be doing all the work. Miss Kim will just be in a comfortable upright position. And we want to make sure that when we're doing the exercises, we're supporting at the shoulder joint and also providing support at the forearm. The first exercise that we'll be doing is the shoulder flexion and shoulder extension. Shoulder flexion and then coming up. And we want to check with the patient to make sure that they're comfortable. Are you feeling any pain or discomfort, Miss Kim?
No, I'm okay.
Okay. And then we want to bring it down. If they are unable to speak, we also want to look for any facial grimaces or any signs of discomfort. If we see any, we would want to stop. We would do this movement for 5 to 10 times as tolerated. At this point, we're at the neutral position and we're moving into shoulder extension, moving the arm back, the shoulder back as far as it's comfortable, or when you feel a little resistance, you should stop. And again, 5 to 10 times is tolerated. The next passive range of motion movement is shoulder abduction. Again, supporting, moving the arm out, bringing it to full range. Any discomfort?
No, ma'am.
Okay, good. And then shoulder adduction, returning arm to side. Again, 5 to 10 times as tolerated. We would then do shoulder horizontal abduction, moving the shoulder out, but still providing support. And then bringing it forward midline for adduction, shoulder horizontal adduction. And again, out for shoulder horizontal abduction while providing support and bringing in midline, shoulder horizontal adduction. 5 to 10 times as tolerated. We would then want to do shoulder internal rotation, providing support, shoulder external rotation. Any discomfort, Miss Kim?
No, it feels fine.
Okay. Again, shoulder internal rotation, shoulder external rotation, providing support. Next, we'll want to work on the elbows. For the elbows, we'll be doing flexion and extension. So elbow extension, elbow straight, elbow flexion. Elbow is bent with support. Extension, flexion, elbow bent. 5 to 10 times as tolerated. The next exercise for elbows and forearms would be supination, turning the palm upwards. Pronation, turning the palm down. Supination, pronation. And we want to make sure we're making slow, controlled movements, not to overwork the muscles. For the next area, which will be the wrist, that we'll be doing passive range of motion exercises, I'm going to get closer to the client at a more comfortable level to provide better support. And so for the wrist, we'll be doing wrist extension, neutral position, wrist extension, supporting the wrist, bending the wrist backwards, wrist extension, wrist flexion, bending the wrist forward, extension, flexion. 5 to 10 times as tolerated. Next, we'll want to do ulnar deviation, thumb towards pinky, radial deviation, thumbs toward the body. Ulnar deviation, thumb towards the pinky, radial deviation, thumb towards the body. This can also be done on the table for better support. So again, ulnar deviation, thumb towards the pinky, radial deviation, thumb towards the body. 5 to 10 times as tolerated. Next, we'll want to do hand MCP extension and flexion. So MCP flexion, we would want to make sure that the forearm and elbow is stable. We would want to cup in the hand, bending at the MCP joint for flexion, and pulling back for extension. Flexion, extension. Flexion, extension. Okay, and again, 5 to 10 times as tolerated. Was that okay? Any discomfort?
No, ma'am.
Okay, great. So then next we would want to do the IP, flexion, and extension. So that's each finger at these two joints. So still cupping, but doing one finger at a time. Flexion, extension. Flexion, extension. And of course, we'd want to do these 5 to 10 times as tolerated per finger. And then we would move to the next finger. Flexion, extension, flexion, extension. And then we'd move to the next finger. Flexion, extension, flexion, extension. And we'd want to do this 5 to 10 times as tolerated. Was that okay? Any discomfort?
No.
Okay, great. So the last one we want to do is the CMC, which is the thumb abduction and adduction. So again, we can use a table, a surface to help stabilize. And thumb CMC abduction, we're moving the thumb upward away from the index finger. So abduction, adduction, bringing it back towards the palm. CMC thumb abduction, bringing the thumb up away from the index finger. CMC thumb adduction, bringing the thumb back towards the palm. Again, 5 to 10 times as tolerated.